Hello guys, today we are going to talk about the anatomy of the tongue. Well, tongue is a muscular organ and it is located in the floor of the mouth, and it helps in taste, speech, chewing, deglutition, and also sometimes clean the mouth. Can you imagine ourselves without tongue? We wouldn't be able to eat, taste food, speech. Well, tongue is a voluntary muscle as it is a skeletal muscle. But funny thing is that sometimes they act involuntary, as in classroom when teacher asks a question. That was just a joke. So let's get started. These are the areas where tongue receive taste sensation. As you can see, the tip of the tongue receive sweetness, and on the side receives saltiness, and more on the side receives sourness, and posterior part receive the bitterness. The tongue is divided into three parts. They are root, body, and tips. So this is the root of the tongue, and this is the body of the tongue, and this is the tip of the tongue. And this root is attached to the styloid process and soft palate above, and below is the mandible and hyoid bone. The styloid process is the structure that is present in the base of the skull. So because of this attachment, we are not able to swallow the tongue itself. The tip of the tongue forms an anterior free end. As you can see in the picture, the root of the tongue is attached to the styloid process here. So this is the styloid process, and also below it attached to the mandible here and hyoid bone. The body has two surfaces. The upper one it is called upper surface or dorsum of the tongue, and below one it is called inferior surface. So this is the picture of upper surface or dorsum of the tongue, and this is the below surface and it is called inferior surface. The upper surface or dorsum of the tongue is convex and it is divided into three parts. So it is divided into three parts here, here, and here. So this is called anterior two-third of the tongue, and this is called posterior one-third of the tongue, and this is the posterior most part of the tongue. The anterior two-third of the tongue and the posterior one-third of the tongue are separated by the V-shaped line, and this line is called sulcus terminalis. And this V-shaped line meet at a point called foramen cecum. This is the point where the V-shape meet. The anterior two-thirds of the tongue is rough and irregular, and there are four types of papilla. They are foliate papilla, this is the foliate papilla, and circumvaled papilla, filiform papilla, and fungiform papilla. The foliate papilla are present in front of the palatoglossus arch. So this is the palatoglossus arch. This is the palatoglossus arch, and just in front of them you can see 4 to 5 vertical folds called foliate papilla. These help in taste sensation. These are not well developed in human, but they are well developed in animals like rabbits. The circumvaled papilla is also called valid papilla, and they are the largest papilla. So these are the circumvaled papilla. They are 10 to 12 in number, and they are mushroom shaped. These papilla are present just in front of the sulcus terminalis. So the V-shaped sulcus terminalis is here, and they are present just in front of it. If you see the histology of circumvaled papilla, the superficial surface, this is the superficial surface, and it has keratinized stratified squamous epithelium, while the lateral surface here, they are non-keratinized stratified squamous epithelium. And taste buds are present on the lateral sides as seen in here, and also the main character of this papilla is presence of minor salivary gland called von Ebner's gland. So these are the von Ebner's gland. The fungiform papilla are dome shaped and they are present on the dorsum of the tongue. So as you can see in the picture, so these are the fungiform papilla, and they are present at the sides and tip of the tongue. So, and the lining epithelium is non-keratinized stratified squamous epithelium, and also it has taste buds. So filiform papilla, they are the smallest of all papilla. They are presented as the hair-like projection on the dorsum of the tongue. So on the middle side there are a lot of filiform papilla which are projected as the hair-like follicles, and in the histological section they are seen as a cone shaped lined by stratified squamous epithelium. and they have a thick keratin at the surface, and they do not have taste buds. The inferior surface of the tongue is smooth without any papilla, as you can see in the picture, and in the middle there is a fold. This fold, it is called frenulum linguae, and on the either side there is a blue structure, and this is called deep lingual vein. And just lateral to this deep lingual vein there is another fold here, and this is called plica fimbriata. And on the base there is a duct of the salivary gland on the both side, and they open into the middle here. Also in the picture you can see the median fold here, and this is the frenulum linguae, and the blue structure, it is the deep lingual vein, and on the either side is the plica fimbriata. The duct of the salivary gland open into the middle. So these are the anatomy of the anterior two-third of the tongue. The posterior one-third of the tongue, it is also called lymphoid part of the tongue. So here is the posterior one-third of the tongue, and it is present just behind the sulcus terminalis. And this region has no papilla, but there are a lot of follicles called lymphoid follicles, and these are the lymphoid follicles here, as you can see, and these collectively form lingual tonsils, while the posterior most part of the tongue is connected to the epiglottis, as you can see here, and there is the depression in the either sides here and here, and these are called vallicula. Now let's talk about the development of the tongue. The tongue is developed from the pharyngeal arches during fourth month of intrauterine life. So during the development, the mandibular arches proliferate and give two swellings called lingual swellings. So here are the two swellings, and these are called lingual swellings. And also these two lingual swelling are separated by another median swelling called tuberculum impar. Also during the process, the second, third and fourth arches show another swelling called hypobranchial eminence. So they form another swelling which is called hypobranchial eminence. Now this hypobranchial eminence has cranial part and caudal part. The anterior two-third of the tongue is formed by the fusion of two lingual swelling and tuberculum impar. So this structure gives rise to the anterior two-third of the tongue. The posterior one-third of the tongue is formed from the cranial part of the hypobranchial eminence, and this caudal part gives rise to the posterior most part of the tongue. Now the nerve supply. In the anterior two-third of the tongue, the sensory is carried by the lingual nerve, while the taste sensation of all the papilla is carried by the chorda tympani except circumvaled papilla. While the posterior one-third of the tongue, the sensory and the taste sensation are carried by the glossopharyngeal nerve, and the posterior most part of the tongue, it is supplied by the vagus nerve.